Turning now to your community focus, November is Lung Cancer Awareness Month, and joining me live in studio with some important information about the illness is Dr. Anuradha Ramaswamy, the Medical Director of the Bronchoscopy, Interventional Pulmonology and Lung Nodule Clinic at Kent Hospital. Thanks so much for being here.
Thank you so much for having me here, Kayla.
So just to start, let's start with the basics. Talk to me a little bit about lung cancer and what people should know about this illness.
Sure. So lung cancer is actually the #1 cause of cancer-related death in the United States and worldwide. So it's very important for us to understand lung cancer and know how we can try to get screened. Lung cancer, the prevalence or the number of cases in the United States is over 240,000, and Rhode Island is higher than average in the number of cases of lung cancer that are there. The most common cause of lung cancer is smoking. So about 80% of lung cancers occur in smokers, but there are about 15 to 20% of lung cancers that occur in people who have never smoked. So it's important for everyone to really be aware of what lung cancer is and so that they can do something about it. And I think the important thing is people need to also recognize the symptoms of lung cancer. If people have a cough that just is persistent, doesn't go away, if they have some weight loss, if they have just worsening shortness of breath, chest pain, weight loss, just fatigue, anything that might indicate that there's something going on that is just unusual or different, they should speak to their doctor. And there are other non-smoking causes of lung cancer, like radon exposure, asbestos, other environmental agents. So it's important to just keep aware of all of these things so that people have a higher thought process when it comes to lung cancer. They can seek help.
And I wanted to ask you too about screenings for lung cancer. Yeah. Who exactly should be getting these screenings, and what can people expect if they do, get one?
It's a great question. So lung cancer screening or screening for any disease is to try to detect that disease when people don't have symptoms. In case of lung cancer, Medicare and all insurance companies and all organizations have approved lung cancer screening for patients who are between 50 and 80 years old, who have smoked, who are either current smokers who have quit within the last 15 years, or who have smoked for what we call 20 pack years, which is a multiplication of the number of cigarettes per day times the years that they've smoked. So it could be 1 pack a day for 20 years, or half a pack a day for 40 years, or 2 packs a day for 10 years. But if that total number comes to 20 or more, they're eligible for screening. So if anyone is currently a candidate for screening, or if they know someone who's a candidate for screening, they should let their physician know, because they need to have a discussion on screening itself, on the risks and benefits of screening, and then an order can be placed.
And why is this something that's so important to you and other doctors here in Rhode Island?
So Rhode Island is actually #2 in the nation for lung cancer screenings, but our overall rate of lung cancer screening in the United States is only about 6%. So it's pretty low compared to some of the other cancers. Because it's the #1 cancer killer, and because lung cancer screening can detect lung cancer at an early stage, it's potentially curable when it's detected at that stage. So if we can improve the awareness among people regarding lung cancer screening, we can potentially cure cancer before it gets to an advanced stage. And that will actually improve survival, and people can live longer and live better.
A lot of important information there. Unfortunately, that's all the time we have, but we'll put a website, a link to your website on our website so people can learn more information. Dr. Anuradha Ramaswamy, thanks so much for being here.
My pleasure. Thank you for having me.